Okay. Okay. Good morning at all. Greetings from Switzerland. I am Vincenzo. I'm a lecturer and researcher in University of Applied Science of Southern Switzerland. My topics are social in particularly because I am also nurse after I have my PhD like sociologist, but it is not important. It's only for understand you my qualification. I present you my research in our country about technological innovation in healthcare organization. So the structure of presentation is the aim of the research, methodology very briefly, some findings in particularly, and conclusion. What I want to understand in this research is what are the determinants factors that when you want to implement organization in some field, you in particular in this case in healthcare organization, you have to understand before. And after, what are the implications for nursing professional practices? Because my topics are on nurses and on nursing in particular. Also, I work with occupational therapist and also physiotherapist, but my focus is on nursing in this research in particular. A definition of technological innovation. In generally, you can see here the technological innovation must be to better give better performance to help professionals work more quickly and effectively. In my particular, my technological kind of technological innovation, it was is hospital information system in particularly. I observe in the reality, in our reality in particular, but also how I can show you after some discomfort from nurses to work with technological innovation. Nervous is discontent. They are not so happy to work. Not all, but some different people are not so happy to work with technology. They have a problem to work with technology in nursing field, of course. But in literature, what I find, the two contradictory tendencies. The first, that managers are also happy to implement technological innovation, always happy, because they think they can have a better performance, they can control better. In particular, technological innovation is abstract, and so they can use them it in a lot of kind of different fields or different services in the same institution or organization. For manager, this is very important. But in the same time, we have a failure rate. A lot of projects of in technological innovation have failed, and this is a strange questions to understand. What are the characteristics of technological innovation that I want and little bit show you is budget, of course, leadership, management, implementation, user involvement. I wanted to attract your attention in this to user involvement and implementation, in particularly user involvement, because is the topic that are that have a lot of problem to is understood in project of implementation of technology, because a lot of sometimes people or manager uh, um, they think the budget, the project management, supportive leadership sometimes, but is in generally top down. But they don't understand better what we can mean to user involvement, and I focus a little bit to this field. So from this observation is born my research question that I show you. In particularly, I want you attract your attention to what are the determinant factors and the relationship, but not only what is the determinant factors, but how do these factors affect the full adoption, not only the introduction of the technological innovation in healthcare organization, because this is the question. In the high failure rate, the main rate is the not full adoption by the actors involved. And this is my effective question. I use a mixed method design because in literature they said that is the best approach. Use the one model, Use-It model, adoption model. I want to attract your attention to this micro relevance, to this part of the model. What is what we must to mean about micro relevance? That is one of the four factors of the model that I revised because it's not adequately organized for me in my research. And so micro relevance is the degree how to which USIT helps solve their problem here and now. In nursing field, it is very important because it's not so obvious that needs of patient need is to they must to be solved here and now, not tomorrow or in another moment. When patient have a need, nurses must to be solved this problem, these needs now. And so for this is important micro relevance. Also is important directly micro requirements that are the technological requirements to solve, to help to solve this problem. I developed the model and I revised the model in this way because I find a lot of difference from micro and macro relevance. Macro relevance are more intended to big macro objective of the institution or the organization. Micro relevance is more situated here in the here and now to the bedside of the patient. This is my research hypothesis that they want to investigate the relationship about the factors of the model. These are the questionnaire and the research questionnaire in qualitative approach. Research question in qualitative approach, because I want to understand also how changing the scenario of the nursing and not only understand what factors affect in particularly. Because it's important to understand in terms of space, time, and action. These are three factors of the scenario of nursing work. I ran 5 of focus group for the qualitative research tool. These are my teams, principal teams of my focus group. And in the context of research is in EOC, multisite hospital of Ticino in Switzerland. These are Ticino, that is a little region of Switzerland from Italian language in Switzerland. And these little red balls are the hospital. This is the most important hospital in our region, most bigger. I developed the research in all this hospital. I carry out a sample is not probabilistic because it's not possible, but from 246 subjects, but I control that the characteristics of the sample are representative to the characteristic of the population working in the OC by age, gender, and work experience. From my findings, this is one important findings to representative presentation of the sample, because gender is important in nursing field, and the sample is representative from this way. This is a correlation table. We can see in the yellow the most important correlation by micro relevance to micro requirements is the most important. The second is from macro relevance and the micro relevance, and the macro requirements to macro relevance. Is a little bit few resource correlation, that they have correlation but not so significant. But what say now this table of correlation? They say we in the model, the factors of the model have significant correlation between, but it's not clear in this table what are the direction of the correlation. So we can show, we can see this in these slides. The direction, the most important correlation is from micro relevance to micro requirements, and from micro relevance to macro relevance. This said what? That the micro relevance is the most important factor in the model. It directs all the correlation about the most important factor in the model, and it's important too because micro relevance time something no okay micro relevance affect micro requirements, or in terms of reality. This said say our that the importance of the work, daily work of nurses must to be affected the characteristics of the technological artifact, in particular innovation, and the objective of the nursing on the bedside is more important that to the objective of the department or the organization from nurses' point of view, of course. Other question, age, gender, and work experience is not relevant. By qualitative findings, I don't present you a lot because I have no time. And so I give you, this is inside in this summary scheme that after I will go to conclude my presentation. So we have technological innovation. Micro-relevance is the principal factor, that most important factor that for solving problem here and now. This generate innovation, organizational innovation. So micro-relevance by technological innovation generate organizational innovation. About this factor that I found by focus group, in terms of interpersonal relation, this change, information that can become the most important factor in the organization. When you use an information system, it's important the skills to manage information in a good way. And after practices changes is changed by the technological innovation in terms of micro-relevance. The other two factors that change this framework is time and space, interpersonal relation by synchronous and asynchronous in the same hospital or in the same services or region. So also information that I can receive this in terms of different time, and the practices in terms of also by space is important to understand. It's not normally to understand work, nursing work practices in terms of not in the same space from two patient and nurses. By technological innovation, I can monitoring a patient in another room, and I'm working in another room different. And so, who are care in this time the first patient? This is important to understand for the nurses, and this change need remodulation of work in terms of micro and macro level organizational management, care planning, different organization of daily work, and provision of care in terms of direct care on the bedside of the patient. So, clinical complexity, of course, have a role in this scheme. I go to my conclusion. First, micro-relevance is a code that determine the technological innovation requirements, and also the organizational management. The question is not only to identify the relevant factors, but also re-examine the practice in order to rebuild them. When we insert innovation, technological innovation in organization, we must understand that we must to re-examine the practices and rebuild them. It's not only insert the technological innovation because technological artifacts cannot be considered now as a tools, but they are also and first, technological organizational factors. This is most important to understand. Nurses also cannot consider they are only, I am mediator from my patient, technological innovation, and I am here to mediate between these two. But in this time, technological innovation become a structural component of care, because hospital and healthcare organization are now considered the technological dense environments, and so technology in this way make produce sociomateriality practices. The introduction of technology into organization make necessary to redesign the organization on several levels. It's not only introduce a chair or a table in one room or in another room. So I thank you for your attention and give you also the